Hi, thanks. Hi again, everybody. Thank you for asking me to speak again and to just highlight our center at the University of Rochester, which is Golisano Children's Hospital. So we're primarily a clinical site, and we have expertise in providing highly personalized and accessible care to patients and their families. It's important to us to provide outstanding patient and family-centered care, evidence-based, and we work very quickly to provide patients and families what they need in terms of our accessibility and responsiveness. We have a great team. Here is our core team. And then, of course, we have the expanded group of specialists that you've heard about at any large academic center. So I'm our center director. I have special expertise in Krabbe disease, newborn screening classification, and clinical follow-up, as I talked about yesterday, but have been taking care of children with white matter disorders for just about a decade. We have Dr. Alex Petrikowski as our associate director and a specialist in pediatric neurogenetics, which is quite helpful collaboration. Our nurse practitioner is Nicole Walsh, and she is our nurse practitioner and our coordinating care coordinator as well. We have Dr. Paul Vermillion, who is pediatric palliative care, and we think it's very important we actually get Dr. Vermillion involved with all of our patients up front, and we feel very strongly about the importance of palliative care and supportive care for our patients. Kathy Wright, our nurse with special expertise in leukodystrophy nursing care. We have, as many of the other centers, our own genetic counselor who's available to meet with all of our families, and a wonderful social worker, Emmanuel Smith. Next slide. So we specialize in the diagnosis and management in terms of treatment and supportive care of all inherited white matter disorders. We follow 10 to 15 plus different types of inherited white matter disorders. Here is just a short abbreviated list of some of the different affiliated specialists that we work very closely with, our therapists, our GI doctors and feeding specialists. We do have pediatric transplant specialists and can offer bone marrow transplant for any patients and families who can't or do not wish to travel to an outside transplant center. So we do have that availability here. Respiratory therapy, sleep medicine, which is incredibly important, palliative care, as I mentioned, and developmental pediatrics. Next slide. So we, as many of the other centers, are very well versed now in telemedicine over the past year. And I'm happy to say that we, in our patient family centered approach, are committed to continuing that telemedicine presence with a lot of flexibility for families as to what works best for them at any given time, and can easily transition between in-person and telemedicine care. Next. And our center, although we are primarily a clinical center, we are involved in some research-based activities, like you'd see on the bottom there, the paper that I had talked about yesterday, and through the wonderful LCN and symposiums like this, we're highly connected to many different transplant and research programs around the country and internationally, so our patients can easily get involved in those different programs. So, so that's just a little brief introduction to our center. For those of you who are patients or patient advocates and or health professionals who know of patients in the upstate New York region, if you're looking for care, either collaborating with or independent care in the upstate New York region, and looking not to travel long distance, please come see us. We're here. Thanks.